We have a big spotlight too. It shines right down on you. It gets really hot. Yeah. It looks like we're live, committee. Let's go ahead and start labor and health this morning. It's a very lengthy bill. Let's have roll call, please, Mike.
Good morning. Roll call for March 12th. Senator Bouchard. Here. Senator Furphy. Here. Senator Hutchings. Here. Senator McCune.
Here.
Chairman Baldwin.
Here.
Thank you. All present.
Thank you. Committee's all here today. We have one bill on our agenda presented to us today by the Mayor Famous, Senator Kinski. The bill we're hearing is Senate File 129, Medicaid coverage licensed pharmacist. Take it away, Senator Kinski.
Thank you, Mr. Chairman, members of the committee. Thanks for this opportunity. It's greatly appreciated. So this bill is very simple. It goes into our Wyoming Medicaid statute in section 42-4-103, titled Authorized Services and Supplies. And it adds to the list of others there, it adds the professional services of a licensed pharmacist. So by way of background as to how this came about, if you reel back the time machine to last February, as the crisis was coming on and we were running out of masks, and it was an act of patriotism to sew masks and make sure those got to the hospital, and everybody was asked to do something, we had a real shortage of testing. So Matt Meyer, who is a pharmacist with a hospital pharmacy in Sheridan, has been there for, I don't know, the pharmacy itself, probably over 100 years. He decided he was going to get some PCR tests and do some testing and help out with that backlog. And in fact, that's where my wife and my kids and grandson, we all got tested through hospital pharmacy. And things as they are, you zip ahead, he submits the claims to the insurance companies and gets back a lot of denials. That's the way the healthcare system works sometimes. And so there's a variety of reasons that they don't want to pay. He's working through every one of them. One was he had to get a certification as a clinical laboratory, and he's gotten that taken care of. But there are some other insurance companies that say, well, we don't see you listed as an authorized Medicaid provider. And so the purpose of this is not to bill Medicaid. Medicaid is, in fact, is paying. Not well, but they're paying. But these insurance companies are saying, we don't see pharmacists listed in your list of authorized services for the state of Wyoming. And and in fact, they're correct. It's kind of interesting. So the statute now says authorized service and supplies. Service and supplies authorized for medical assistance on this chapter include inpatient hospital, outpatient hospital, skilled nursing home services, professional services of physician, chiropractic doctor, osteopath, home health services, family planning services, all kinds of services. Then it says prescription drugs and oxygen, without ever actually calling out pharmacists. So this simply adds pharmacists to that list. And the idea is not necessarily to be paid by Medicaid, but for some reason, these insurance companies want to see that on that list in Wyoming. And we have every indication from the work we've done in researching these claims that's going to help this young man get paid. It's not a guarantee. But it helped him. So the objective is not to get any additional coverage from Medicaid, but simply to bring these private insurers to the table so that they will cover this stuff. And I believe Mr. Meyer is on the phone or on the Zoom now, actually, at some point, but I stand for questions, Mr. Chairman.
Thank you, Senator Kinski. Mr. Myers is here in the room floating around us until we call him in.
Okay.
It's like a seance. Questions for Senator Kinski committee? No questions. You're off. You got one. I'm sorry. Go ahead, Senator Hutchins.
Thank you, Mr. Chairman. Thank you, Senator Kinski. My question is, he's not looking to be paid by Medicaid, but could this open up for other pharmacists to be paid via Medicaid?
Senator
Mr. Chairman, Senator Hutchings, he actually has not had any trouble getting paid by Medicaid. Not a lot. They pay $51, which covers just the cost of the test, doesn't cover any of the supplies, doesn't cover any of the time or the labor involved. And as Chairman Baldwin knows, that's if you can just cover your direct out of pocket on Medicaid, you count yourself lucky and go home. It's the private insurers that are saying, well, we don't list you listed in the Medicaid. And they've got other reasons too, but this is one of them. And again, this is not a guarantee that it'll get paid. They may say, well, it's in the statute now, but it wasn't there last year. We don't know, but I'm just trying to help this fella have a fighting chance.
Follow up.
Sir, you said something that kind of brought up another question. You mentioned that he's having no trouble being paid by Medicaid, but how can he be paid by Medicaid if he's not on Medicaid? Or this program isn't on Medicaid?
Mr.
Senator
Chairman,
Kinsey.
Senator Hutchings, I wish I could tell you that the medical billing and reimbursement system in the United States was truly rational, and it's hard to figure. They're paying for the tests, and not a lot, but they're paying. I spent 13 years in this, and the reason I got out of healthcare was because the reimbursement was trying to fight and to get paid was just going to kill me.
Gotcha.
And, but to go back to there's another concern that I don't think I fully addressed. You said, could this open up the door for additional payment by Medicaid? Only if Medicaid decides they want to pay for anything. They have a list of authorized services. And if you're not on that list, they're not going to pay it. They don't. So for instance, if a doctor decided they were going to do tattoos and submitted a claim, doesn't matter that physicians are listed there, tattoos are not a covered service.
Mhm.
So this is not going to open Medicaid up to any additional liability.
Thank you, Senator Kinsey. Senator Bouchard.
Thank you, Mr. Chairman. So I want to ask specifically about the tests, because I looked at those tests, how they're covered through the health department. So are we saying that when a pharmacist does the test, there isn't a way for them to bill? Because what I saw under that section is that medical providers, and it did not exclude pharmacists in that. So I'm trying to figure out where we're going with this.
Senator Kinsey.
Mr. Chairman, Senator Bouchard, I'm not entirely clear on what your question is, but the state Medicaid program is paying this fellow for the tests that he's conducting. It's I don't want to call out any particular health insurance companies, but there's 2 or 3 that he's having difficulty getting fully reimbursed for his services because he's not listed in the Medicaid code. But follow up, Mr. Chairman, if I could, I don't know if I'm answering your question, Senator Bouchard.
Follow up, go ahead.
Thank you, Mr. Chairman. So when I looked at the code under CMS, it had the people that could actually be paid for the tests. So I can't figure out how this bill changes that, because that comes down from the feds on how that test is paid for.
Senator Baldwin.
Go ahead.
Senator Bouchard, CMS is the Center for Medicare Services, and that impacts what Medicare does. It doesn't impact what Blue Cross of Wyoming, it may be one of them. It doesn't tell them that they have to pay a pharmacy in Sheridan, Wyoming for a test that he conducts. They have their own set of rules. They very often are guided by CMS, but they're not controlled by CMS in that regard. So what they're saying, and I shouldn't have used the name of that might not be one he's having trouble with, but private insurance company A, they decide what they cover and what they don't cover. And in this instance, they're saying, we don't see pharmacists listed in the state Medicaid code. So they look for some guidance to the Medicaid code. And that's not because we require them to do it. That's just their rules. So we think that adding it to the code will give them a leg to stand on, and with some of these private insurance companies. I wish, it's really hard to believe how complicated and topsy the reimbursements. And that's one reason medical care in America is so expensive, is just trying to get paid for the service. I used to, don't get me started, but we used to get a phone call and I could have a complete hospital room set up in your house, including a ventilator, life support, 2 hours. 2 months later, I was still trying to get paid. 6 months later, you'd still be trying to get paid. I had 2 people trying to get paid for every person delivering a service. And it's just, it's wrong, but that's, we don't make the rules, we just play by them.
Thank you, Senator Kinsey. Senator Bouchard.
Yeah, Mr. Chairman, kind of off topic on this bill, but what you were talking about is exactly why Medicaid expansion is a problem. Because that's what we hear from the doctors all the time, is that if they get stuck in that system, they might as well go out of business. And so anyway, like I said, off topic on this bill, but obviously the mess that we're in because of those expansions.
Ironically, we have planned for the interim, we have a meeting exclusively to education about Medicaid and Medicare and how the system works. You'll find that the private insurances often follow what Medicare and Medicaid reimburse, what they do, et cetera. Medicare, Medicaid, and there's several people in the room could comment on that, but their reimbursement rates sometimes don't even meet the cost of providing the care. So it's a very broken system. Go ahead, Senator Hutchins.
Thank you, Mr. Chairman. As you guys speak, more and more questions come to mind. Senator Kinsky, this is such an unfortunate situation, but now, if I get you right, the insurance company will say, okay, you're on this list of Medicare services. So we're going to give you money now. Where is that insurance company going to get the money from, or does it even matter? It's just, oh, because you're on the list, we'll give you reimbursement.
Go
Does that
ahead,
make
Senator.
Mr.
sense?
Chairman, Senator Hutchings, what Mr. Myers found in his research is that some aspects of what he has incurred in terms of billable expense, there are some insurance companies that say, we don't see pharmacy listed on the Medicaid formulary. We see drugs, and a test is not a drug. So you get zero. And what we're hoping is if pharmacists are listed, that he can resubmit those claims and get paid. No guarantee. We're just trying to give this poor fella a fighting chance. And I know it's hard to get our heads around, but that's the way the system works.
Thank you.
Senator Bouchard.
Mr. Chairman, thank you. I had an idea here. So what if we do this and we find out that this is used against insurance? In other words, Medicaid does something, changes to something that doesn't get paid, and now they follow that. So my solution is, what if we put a sunset date on this, and then everybody feels better about it, so that way it doesn't become the Trojan horse that's used against the free market billing, or if we even call it free market, but understand that the other side could say, well, Medicaid doesn't cover this. And now they're going to say on the insurance end, well, we don't cover it either. So how do you feel about putting a sunset on this? And then we can come back and look at it in a couple of years, and if we more where it's an automatic removal, that we have to come back and review it so that we can see if it's working.
Mr. Chairman, through you, Senator Bouchard, I'm not sure I understand the concern, but I'd prefer not to have a sunset date. I think the statute, most states list pharmacists. We don't know why Wyoming doesn't. If that's what it takes to get out of the committee, that's what it takes to get out of the committee is a sunset, then that's fine. But I'd prefer not to. We just need to get our statute aligned with what other states do. I think this is what Idaho did this too. They just added Medicaid there. And if we have another pandemic, don't we want pharmacists to be able to mobilize and do these tests?
Follow up,
Go ahead.
Mr. Chair. No, what I'm talking about, let's say that Medicaid does something where they say these things aren't covered under Medicaid. And now the insurance company uses it as a way to not cover as well. That's what I'm talking about, where the insurance company uses the Medicaid standard in a way that's harmful to the patient. That's what I was talking about. But
I think, Mr. Chairman,
Go
Senator
ahead.
Bouchard, I think that's actually what's happening. We don't list pharmacists, and although state Medicaid is paying for the tests, the insurance company, at least as to some part of the testing process, some of them are saying, you're not listed as a Medicaid, pharmacists aren't listed under Medicaid, we're not paying for the tests. And so it's actually being used to the disadvantage of the patients and this young man. he's a nice guy. I told him, I said, Matt, you may just have to drop a bill on everybody who came through and got tested if you're not going to get paid for it. And he goes, you know, I just don't want to do that. I'd rather do everything I can to make sure that we get paid from these insurance companies. So it is, not having pharmacists listed here is operating now to the disadvantage of patients and families.
Senator Hutchings.
Sorry,
ahead.
Mr. Chairman, but thank you. Just more stuff is coming up as we speak. This law won't go into effect until July 2021. So your dear friend Matt, is he going to submit another claim after the fact to get this claim? Because will this law help him for a past event?
Mr. Chairman, Senator Hutchings, I actually wanted it drafted to say, due to the COVID emergency crisis, pharmacists are a covered service on the Medicaid effective as of January of 2020, and LSO wouldn't let me do it.
Follow
Right.
up.
I wanted to make it retroactive.
I think at the very least, we could change it to immediately, but it wouldn't be able to go
Yeah.
retroactive to what's done.
It wouldn't.
So, Mr. Chairman, then.
Go ahead, Senator.
Senator Hutchings, so I don't know whether it's going to help him or not. We think it's worth a shot. And again, in the topsy-turvy world of medical billing, it probably shouldn't make a difference. But see, after the fact, some of them said, go get a certified laboratory certificate. And he did after the fact. That was enough. They paid him. So even though he didn't have the certificate at the time of the test, as long as he had it at some point. So we're hoping by the same sort of logic, it'll help him with the Medicaid, with the private insurance companies, even though it's not effective till July 1. Although I think an effective immediately might help.
Follow up, Senator Hutchings.
Yes, Mr. Chairman, thank you so much. And sorry, Senator Kinski,
No,
but
you're fine.
does he not qualify for some type of reimbursement from the millions of COVID dollars?
Mr. Chairman,
Go ahead.
Senator Hutchings, you would have thought. You would have thought
And
not.
Senator Furphy, you had a question?
Thank you, Mr. Chairman. Thank you, Senator Kinski. I don't know if there's a group of pharmacists in Wyoming, but I assume the pharmacists themselves would be in favor of this bill. Do you agree with that?
Mr. Chairman, Senator Furphy, in fact, the State Pharmacy Association is here to speak on the bill this morning.
And we will get him up here shortly. Are there any further questions, committee?
Mr. Chairman, I did want to follow up with Senator
Go ahead, sir.
Hutchings. I have been working with the governor's office. I thought there was COVID relief money to cover the cost of testing.
yeah,
And in this situation, we've not been able to find it. I mean, there's lots of loopholes in it. For instance, I thought, I have a friend that he had to lay his 35 employees off. His unemployment insurance rate's going to go up and stay up. It's because he was not ordered to close. His business evaporated. He had to lay them off because he had no business. He couldn't do a PPP because he had nothing for him to do. So his unemployment insurance rate is going up and staying up. And I said, well, wait a minute. I thought, what happened to all those billions of dollars? He gets a goose egg out of that deal. Yeah, there's a lot of things that we thought were going to be paid for by all that COVID slosh that aren't being paid for.
I sense a whole nother topic here.
Yeah.
Go ahead, Senator Hutchings.
sorry, coming back to the slosh. When the 1.9 trillion that is coming down the pipe comes to us, is there a possibility that we could include this in that when those bills come up and we're in session?
Go ahead, Senator Kinski.
Mr. Chairman, Senator Hutchings, I hope so. I think when you see the fine print on what went in there, there's a whole lot of special interests that are getting money that's being called COVID relief, and you'll be hard pressed to figure out how it relates to COVID.
Okay, committee, further questions? We're straying a bit here. No further questions. Thank you, Senator Kinski. Let's bring up the
And-
Wyoming pharmacy.
And Mr. Chairman, I'm going to listen in for a little bit, but then judiciary scheduled 2 more bills right on top of these. So
We will let you know the outcome, I promise.
all right. Thank you. Thank you, thank you, committee
Thank you,
members.
Senator. A familiar face to this group. Go ahead and introduce yourself.
Mr. Chairman, good morning. My name is Craig Frederick. I am the Executive Director of the Wyoming Pharmacy Association. And I'm here to speak upon this bill. And we certainly know that we've had a lot of issues with the COVID testing and being reimbursed, which was prompted this bill to come forward. But my testimony today will be more of what Senator Hutchins was talking about, maybe a broader picture as to what this bill can mean to pharmacists in the state of Wyoming. Certainly, it will help and give us credibility and recognition from other third parties that view that, as Senator Kinski was talking about. But again, I'd like to just talk about how providing or including pharmacists as pharmacist providers, what that can mean for the state of Wyoming as we go forward. It's no secret that health costs continue to rise. Medication costs are a huge part of that. According to the 2019 Wyoming Medicaid annual report, over $61 million were spent on medications in the Medicaid program. And this number is a 50% increase from the $40 million that was spent just 5 years prior to that. So there are many potential solutions that I've been here and talked with the committee before about how we get these costs under control. Many solutions have been discussed and utilized in order to keep medications costs as low as possible. However, there's one solution that I believe is being overlooked, and that is that ensuring that current regimens, so medications and the regimens that patients are currently on, are safe, effective, and cost efficient. With patients seeing multiple providers and oftentimes being forced to use multiple pharmacies, now more than ever, it's imperative that patients have continuity of care that optimizes their medication use. Pharmacists are a healthcare professional that are perfectly suited to assist in ensuring that our state is getting the best bang for its buck in the Medicaid program and also giving the recipients the best care possible. Pharmacists have the education, they're accessible, and the legal authority to handle this challenge. However, pharmacists currently are not recognized as providers in that Medicaid statute, obviously what the bill is pertaining to. And they are unable to bill Medicaid for pharmacist services in which we can and are often already performing in the state. Most all of the payments in which pharmacists can receive at this point in time from the Medicaid program are tied to the dispensing and with immunizations administration of products. It is all based around a product-based system for pharmacists to get reimbursed. Any enhanced pharmacist services such as medication therapy management or MTM and chronic disease management consulting must be billed in conjunction with another provider, if they are even billed at all. There have been numerous studies that have shown that pharmacist-led medication intervention programs have shown a decrease in overall healthcare expenditures, not only in efficient medication regimens, but also decreased adverse events leading to emergency room visits and hospitalizations. An American Journal of Managed Care article from 2019 found a cost savings of $2.10 to $2.60 per every dollar spent when a pharmacist delivered the comprehensive medication management program. One study involving pharmacist-driven MTM showed an average direct, so just direct cost savings of $253 per year. If you multiply that by the number of Medicaid recipients in the state, that is a number which will allow significant savings. And there's numerous studies also that evaluate the overall impact of the economic impact of MTM services. And some of those studies have shown an overall impact of over $1,000 to up to $3,000 per patient. So our state's own Department of Health Chronic Disease Management Program is utilizing pharmacists now as we speak to assist in some of their current programs related to diabetes, high blood pressure, and high cholesterol. Through these services, though, we are finding it is very difficult to get reimbursed, although the health department finds pharmacists to be a reliable and a needed source to help them with their programs. In passing this bill, I want to point out that it does not mean there is all of a sudden an open checkbook allowed to pharmacists, just as Senator Kinski alluded to in his testimony. As pharmacists could only bill Medicaid for services that Medicaid has authorized as a billable service. Medicaid would control who would be authorized as a provider and for which types and programs and tasks that a pharmacist could be compensated and the amount of that compensation. Passing this bill would at least give Medicaid the option to utilize and reimburse pharmacists as they see fit. Pharmacists around the state have been doing anything and everything that we are asked to do in order to meet the growing need of Wyoming citizens' healthcare needs and filling in the gaps whenever possible. Our recent efforts, which again brought this bill and this interest up at this time, our efforts in administering COVID vaccines and conducting COVID tests, as well as during the pandemic, pharmacists remained open, remained accessible, and very flexible during the pandemic. These are just examples of how pharmacists and how pharmacists are committed to the state and our dedication to our patients. So to conclude my testimony, I just say that in these tough times that we are facing in the healthcare system, I urge you to pass this bill. It is time to invest in the full capabilities of the pharmacy profession to improve the health of your constituents. And so with that, Chairman, I stand for any questions that the committee may have.
Thank you, sir. Questions, committee? Senator Hutchings, go ahead.
Frederick, yes.
Frederick,
Yep.
okay. Sir, I'm concerned. I'm gonna bring up a little phrase my mom used to say to us when she took us to the store, 4 kids. She'd say this all the time to us. I don't have any money, so don't ask for anything. And we never did because we knew she didn't have any money. We just saw that $1.9 trillion stimulus package was just passed. The federal government has no more money. So if we open this up to pharmacists so the Medicaid billing system can choose which services the pharmacist can bill from, where are they going to get the money from to pay the pharmacists?
Go ahead,
Mr.
Mr.
Chairman and Senator Hutchings. That's a great question, and certainly it's one that we have to face. I think that there's many studies out there, other states that are doing or that are able to bill for pharmacist services that can show a savings by utilizing pharmacists. It's what I alluded to in my testimony there a little bit. Even private insurances, so PBMs, pharmacy benefit managers that handle Medicare D programs. An MTM program is part of all of their programs and how they handle the Medicare D services to the members. So they have found a great, if the pharmacy benefit managers are going to utilize it, that they have found a reason and a way to save money in doing those services. So third-party services will pay a pharmacist to do MTM, will pay a pharmacist to do comprehensive medical or regimen reviews with the clients. So there is value in the services that we are offering. And I believe that if we say that Medicaid, if we allow the Medicaid program to look at it and say, okay, what is the value? What sort of services will give value to the program, to the whole, the bottom line that you're talking about? The studies out there prove that you can save money if these are utilized. It's not, I mean, you have to, it's an investment. So you have to spend a little money in order to receive the health and care that is available.
Let me throw in a quick
Yeah.
example here that may be
Yeah.
beneficial.
Oh,
And we're talking about medication management. I'll make myself the patient. I'm an asthmatic and I have high blood pressure. I'm not either one, as for saying.
I'm like, you
And I go to a couple different physicians or providers and they give me medications, they give me prescriptions. One of those medications they give me is a beta blocker. Another medication that I get from my asthma doctor is a beta agonist, is Proventil. My pharmacist recognized there might be a conflict between those two. The higher my dose goes on my beta blocker, you may have heard of metoprolol or Toprol XL. The higher the dose goes on that, the less effective my Proventil may be, or my inhaler may be. When my pharmacist recognizes that, he may well keep me out of the hospital. Because by taking too high of a dose of the beta blocker, I may very well have asthma exacerbation after asthma exacerbation and end up in the hospital. So in the case of paying the pharmacist, we'll just throw out some amount, we'll say $50 for doing that medical management. He's preventing me from having a $500 or $600 a day hospital bill for a week. So in that case, we've saved Medicaid. In the case of Medicaid, we've saved significant money for Medicaid. By paying $50, we've perhaps saved $1,000 or $2,000. So there's a cost benefit for paying for these services and managing things. And that's just one. I could give lots and lots of examples, but that's just one that comes to mind. Follow up, Senator Hutchins.
Mr. Chairman, thank you. I am asthmatic and high blood pressure, and I'm on some of those meds. I may have to have you come look at some of my meds. I appreciate that. And I get it. I get it. Trust me, I get where you're coming from. But again, I was talking to the other senator about the US debt clock. If you've not looked at it lately, it's ticking up, ticking up, ticking up. How can we save when we're trillions? The national debt is over 82 trillion. The US debt is over 28 trillion. How can we save if we're doing this? I get what's going on. With all my heart, I do. But we have to face reality. So that's where I'm coming from. I get it. And I know maybe the pharmacist won't tell you things, or maybe they can charge you right there. But I just don't see going to the federal government is the solution. That's my problem. What do you think, sir?
Go ahead and reply, Mr. Fredericks.
Okay. Yeah. Mr. Chairman and Senator Hutchins, the beauty of this is for Wyoming patients, Wyoming, the constituents that we're representing, the people that you're covering in the Medicaid program. Yes, I know and agree that there is money that comes from the federal government, but I believe this is a state-based issue where the people in our state and our Medicaid program will have the ability to look at all the options available to them to see, is utilizing a pharmacist the best way to save money? If utilizing a pharmacist is the way to keep Chairman Baldwin out of the hospital because of his asthma, then that could be well worth it. But I'd say that we give the opportunity to our own Medicaid program to assess and determine what is best for Wyoming people and what is the best, again, and use the term bang for their buck, as far as if we can pay a pharmacist $50 a year, and maybe a pharmacist will only see one of your patients, once or twice a year, and many cases is all that's necessary. This isn't an ongoing, every time I pick up my prescription, we bill $50. These are more of a clinical based appointment where the beneficiaries will only see a pharmacist, like I say, really usually no more than 2, 3, at the 4 times a year. So that's $200 in that example that Chairman Baldwin used. But I mean, how much is one emergency room visit? If you can keep them out of the emergency room one time, I mean, that's saving 20 recipients the amount of money that you've paid to the pharmacist. So I believe that the money is there, and the Medicaid program will be able to determine how that money will be found in the amount of savings of adverse events and other issues.
Further questions, committee? Thank you very much, Mr. Fredericks. I was just coming up with many more examples in my head, but
Well, thank
We
you,
will-
thank
we
you,
will do
Mr.
that.
Chairman. It's nice to have a medical person on the chairman there. So thank you for the
Thank
help
you.
in that. But thank you, and thank you for hearing me out.
And,
today.
and be sure and thank all the pharmacists, because pharmacists are doing a terrific job. Senator Bouchard, do you have a question?
Yeah, thank you, Mr. Chairman. We went around a lot here. I want to know specifically on this, what your feeling is here, because because you're starting to lose me. All this with Medicaid, I mean, all I see is we're setting us up to be Medicaid expansion. And so I want to know specifically on this, because the problem I see here, and I don't know if you can understand what I'm saying, but I could see even the insurance company later on, let's say 2 years down the road, and say, well, wait a minute, they made a change to Medicaid, so we're not going to pay on our end because of a change over here on Medicaid. And that's what worries me, that we're locking ourselves more into Medicaid gets to set the standard, and we're moving more away from free thinking to where Medicaid sets the standard. Now we're further tying the hands of the whole system. Does that make sense?
Go ahead, Mr. Fredericks.
Mr. Chairman and Senator Bouchard, I think I definitely understand what you're saying. But I think that the Medicaid program, when it comes to their clients and the covered services, I really do believe that they have a good grasp and understanding of which services will be best for the patients that they are serving. Now, whether it's determined if that number of patients and beneficiaries they are serving is expanded or not, that really doesn't affect, I think, just the aspect that pharmacists, with whoever they're serving, has a benefit. And that so I'll use for an example. So we have pharmacists today that are out doing these sort of services. Most of them work for academia. So the University of Wyoming has clinical pharmacists that are in clinics that are handling this enhanced MTM or doing chronic care healthcare management. So they are seeing Medicaid patients, and through the process of billing through clinics and through a provider, they are able to bill Medicaid for those services. But it has to go through a provider. So these things are already being done. And again, legally, we can do these, but this is just allowing pharmacists to be able to bill for something we're already doing without going through the process of billing craziness that, like Senator Kinski was alluding to earlier.
Thank you. Follow up.
Thank you, Mr. Chairman. So what I'm getting at is, so University of Wyoming, in their medical program, what would happen is they would bill through their top provider, top end, I should say. And then, so they're billing the pharmacy, and then that way the pharmacy, well, I say they're billing for that service and then paying the pharmacy on the back end of it is what they're doing now. Because that's what I kind of gathered from what you were saying.
Go ahead, Mr. Fredericks.
Mr. Chairman, Senator Bouchard, there's no pharmacy involved in that case. There's a pharmacist that is giving the care. And so I think it's real important. So some of this care definitely can be given at a pharmacy. And as retail pharmacy, we continue to get bashed over reimbursements and the issues that I've been here many times talking about. This is a way, this is an opportunity for pharmacists to expand and not expand in what we're doing, we're already doing it, but being able to bill for services that are already being done in the Medicaid population. We are billing third parties already for these services, but within the Medicaid population, we are unable to bill for services that are already being done.
Thank you very much for your testimony, Mr. Fredericks.
All right.
We'll let you have a seat back at one of the cold chairs.
Okay, thank you.
Does the hospital association want to testify today or just here for the entertainment? Okay. I know we have some people out there, Amanda, in Zoom land. Let's go ahead and admit whoever we've got in for testimony.
Mr. Chairman, I just admitted Corey Cooper.
Very good, Corey. We're waiting to see a smiling face. And now we see it. Go ahead and introduce yourself and go ahead and give us your testimony, ma'am.
All right. Good morning. My name is Corey Cooper. I'm the pharmacy program manager for Wyoming Medicaid, and I am a pharmacist, Wyoming born and raised and educated. And I am just here to testify what this bill essentially does for Medicaid is gives us the statutory authority to work with CMS through a state plan amendment and with the Wyoming Board of Pharmacy to make sure that we stick with the scope of practice of pharmacists in order to allow pharmacists to bill directly for the cognitive services that they provide in a pharmacy setting. So this has been covered well, and I'm not going to belabor the point, but we're talking about cognitive services that are not tied to product dispensation. For example, medication therapy management and chronic disease management, something pharmacists are trained to do very much within their scope of practice. And right now they can't bill for those services, even though they're services they're well trained to do. And it's they're accessible to patients more so sometimes than physicians and other providers are. With that, I'll stand for questions because I think you're probably going to get better results from my testimony if I answer questions rather than just talk.
Thank you very much, Ms. Cooper. Are there any questions for Ms. Cooper, committee? I see none. You
Wow.
The hook easily today.
Okay.
I would ask you one question. Do you have any experience with any states around us at all, or is your experience in Wyoming? Have you experienced where pharmacists are reimbursed in other states?
I have looked at the numbers in other states. There are a number of Medicaid programs that have allowed pharmacists to bill to bill as medical providers under that for cognitive services. And the numbers vary, obviously, depending on the size of the state and the activity level of the pharmacists in this area. But they are generally able to show a savings overall to a Medicaid program because, as has been discussed already, they're avoiding hospitalizations, they're avoiding extra doctor visits. A pharmacy is an ideal place for coordination of care, as you alluded to, Senator Baldwin, Chairman Baldwin. So it's not unusual. We're not breaking new ground here. There are other states that allow it, and they generally show a savings to the Medicaid program because of offsetting other areas.
And you alluded to one other point. You brought up one other point to it, which hit a note in my mind, and that is pharmacists are accessible. So oftentimes it's hard to get in to see your doctor, your nurse practitioner, your PA, whoever you're going to go see. And sometimes that's a difficult thing to do. There is a shortage. There's a genuine shortage of providers. Pharmacists are accessible. And so it just provides another means of getting that information and that education out there to patients. So thank you for that. Are there any further questions? Senator Bouchard.
Thank you, Mr. Chairman. You know, I want to just focus on one thing. Other states, I want to know if those are Medicaid expansion states, or if they're, I mean, just similar to our situation, because I'm sympathetic to the problem I heard, but I'm very concerned that we're just adding things on piecemeal to do what the expansion states are already doing. So I'm very curious of what states we're talking about that are doing this, because I looked for legislation that was similar and I could not find it on this particular piece of legislation.
Comments, Ms. Cooper?
Mr. Chairman and Senator Bouchard, I would honestly, I don't want to answer that question wrong. So I would have to go back and look at the states that I'm aware of that allow pharmacists to bill as providers and look at their expansion status.
Thank you very much. And if you could, and I would ask Craig, same information here. So perhaps if we know that information, or if we can get it, we can get to Senator Kinski. So if we can get that information on the floor, assuming this goes forward. Thank you very much, Ms. Cooper. Further questions, committee? No further questions. You're off the hook this morning.
All right. Thank you all.
Do we have anyone else, Amanda?
Mr. Chairman, we have Matt Martineau with the Wyoming State Board of Pharmacists.
Thank you. Well, we'll talk to Matt. Matt, the committee he's not new anymore. He's been with us for a year now, almost a year I don't remember the exact time, but Matt's still fairly a new face with us and we appreciate him. And go ahead, Matt, introduce yourself and testify for us. You're muted, Matt. We can't hear you. Can't hear you.
It looks like his Zoom is unmuted, but maybe his computer might not be picking up his voice.
Still can't hear you, Matt. You're giving us that look that we're getting familiar with this year. No, Amanda, do we have anybody else in the waiting room? Well, perhaps Matt figures out his technical difficulties.
Mr. Chairman, we don't have anyone with their hand raised at the moment.
Okay. Oh,
I tried to join by phone. Did that work?
You're there. Welcome. Welcome.
All right. Sorry about that.
Go ahead, Mr. Martin. I'll go ahead and give your testimony.
Thank you, Chairman Baldwin. I apologize for that. My name's Matt Martineau. I'm the Executive Director for the Wyoming State Board of Pharmacy. Just here more to try to answer any questions that the committee may have. Just to let you know, from the board's perspective, we don't really have a horse in this race as far as the bill is concerned because the board doesn't get involved with payment issues. We do have authority to set by rule the sorts of services and things like that that we that the board would consider to be part of the practice of pharmacy. So getting more into what MTM is or isn't, or the tests that are CLIA waived, things like that. But beyond that, like I say, the board doesn't really get involved when it comes to the financial side of things, other to investigate possible violations of unprofessional conduct when a fee may have been obtained by fraud or misrepresentation.
Okay, questions for Mr. Martineau, committee? You got off the hook very easily today. It's good to see your smiling face. Thanks for coming. Amanda, is anyone else raising their hand?
Mr. Chairman, no one at the moment.
Very good. If there's no further testimony from here on the room, let's go ahead and close the public testimony. Anybody on the committee like to move the bill? The bill is moved by Senator Furphy. Discussion on the bill, committee. Senator Bouchard.
Mr. Chairman, I'm sympathetic to what Senator Kinski had, but I'm just not convinced. I saw so many things that we talked about that weren't specific to the problem, very specifically to what Senator Kinski said. I mean, we went all full circle around this. I'm just having a problem. Maybe you clear this up and write to this so I can be clear on it. I mean, I got lost on this one.
I would do my best here. And that is, this is something, I'm trying to think of somebody we brought in last year, and you might remember, I believe it was dietitians. I don't know if, they were not on the list for being able to be billed for Medicaid things. And that's one that we brought in. As we find, as we progress through the years, lots of things, pharmacist, optometrist, I hesitate to bring that one because we're going to hear more about them soon. But we find that more entities are able to provide more and more services that they didn't used to. Pharmacist is one of those, laboratories are another. They're doing services that have traditionally been done in hospitals or in a doctor's office. And those services have always been reimbursed when the doctor does it or when the hospital does it. But now the pharmacist is doing it or some other entity is doing it, they're not able to be reimbursed because under the billing part of this, under Medicaid, they're not able to bill. So the service is still being done, but now we can't pay for it because the pharmacist is doing it. And that's pretty much what this deals with. These are services that pharmacists are now doing, and we would like to get them able to be reimbursed. That doesn't guarantee a reimbursement, but it makes them able. Now, not only that, but in the case of Senator Kinsey was bringing up, insurance companies unfortunately follow Medicaid, or fortunately or unfortunately, I wouldn't want to commit myself to that. They use that as a basis for whether they are going to repay somebody or not. And just throw X insurance company out there. They say, okay, pharmacist Joe did this. You know, we'd really like to pay him for it, but let's go through this list. He's not listed as a Medicaid, reimbursable person. So we're not going to pay it. And I think that's a case of what happened here. And I think that private insurances have a lot of power. Private insurances do things like, I had the experience one that automatically turns down the first claim, just automatically. They didn't even look at it. They just automatically turned it down. When you challenge it, eventually they pay. And I think insurance companies, and they're in tight financial times too, not as much as they claim perhaps, but they're in tight financial times. And so they try to not pay for anything that they don't have to pay for. And I think this is a means that perhaps they can escape that and say, well, they're not listed as a Medicaid reimbursable, so we're not going to pay it. And I think we need to make sure we understand that these are things that are already being paid for when they're done in another capacity. And this just makes this available so they can be paid for a service that's being paid for somewhere else. I don't know if that helped at all.
Yeah, Mr. Chairman, it did, but it brought us right back to the original problem, which that was what we're supposed to fix. But now we're spending more time talking about all these other expansions. So that's kind of where I'm stuck on this. So I don't know. I think I'm going to be a no vote because of that. I mean, I'm sympathetic to the specific problem that Senator Kinsey had with the insurance company looking at this and saying they're not on the list. But I heard more testimony about the other stuff, and that's where I'm kind of getting stuck.
Further comments, committee? Senator Furphy.
Thank you, Mr. Chairman. I'm looking at this somewhat for the smaller communities where they may have a pharmacist, but they may not have a hospital or other organizations that can do testing, et cetera. So I don't think it's fair that the pharmacists in these smaller communities shouldn't be reimbursed for testing and doing other things, trying to help their community. So that's why I'm in favor of this bill. Thank you, Mr. Chairman.
Senator Hutchins.
Thank you, Mr. Chairman. I too am very sympathetic with this cause, and I think I've made that very clear when it comes to Medicaid. But again, the testimony kept flowing back to a service that the pharmacists are providing that they want reimbursement for that goes far beyond what we're seeing here in this bill. I get what my fellow senator said about the small communities. One of the things I know about being in a small community, sometimes you do things for one another out of, hey, I can do this. I used to be an IT specialist, so I would go around and help my fellow friends. I wouldn't charge them for that particular service. You do it out of the kindness of your own heart. And I think for some reason, people just see and I hear that the federal government has this big bag somewhere in the sky where we can just keep drawing money from over and over again. And with everybody coming to that pot, I just don't see how we, as a nation, a state, can do this. This bill does not address what's going on with the pharmacists. And I kind of feel like Senator Bouchard, we're kind of slipping in an expansion in the back door. And so I will be a no on this particular bill.
I would gently push back against that, and I would say that these are services that are being paid for now when they're done at a lab, at a hospital, at our drive-through COVID testing. And in the case of the pharmacist, if they don't get reimbursed for this, then they're gonna go to those places exclusively. They won't go to the pharmacist anymore. So Medicaid's gonna pay it, or whoever's gonna pay it, the insurance is gonna pay it. So it's not new money. It's just a new provider of that service and something that's more available. So just a gentle pushback.
Gotcha,
I don't
sir.
think that, but
Thank you.
further comments, committee, before we vote? No comments. Let's go ahead and vote, Mike.
Senators, this is for Senate File 129. Senator Bouchard. Senator Furphy.
Aye.
Senator Hutchings. Senator McCune.
No.
Chairman Baldwin.
Aye.
Votes are 2 ayes and 3 no.
Okay, committee, thank you for your work. Thank you for your time. Well, I'll inform Senator Kinski of the outcome. Thank you.
And what?